Hi, I'm Mark Duncan and welcome to LVI TV. I want to share a story with you about chewing gum and how it might be causing migraine headaches. Scientists from Tel Aviv University in Israel have investigated the relationship between gum chewing and headaches and discovered a possible connection. In this study, they analyzed children and teenagers, found that 87% of those participants who quit chewing gum experienced significant relief. Headaches are common in childhood, become more common and frequent during adolescence, and particularly among girls. Typical triggers are stress and tiredness, lack of sleep, heat, video games, noise, sunlight, smoking, missed meals, menstruation, but little research has been done on the relationship between gum chewing and headaches. And so this study, they actually took kids that had chronic headache issues, they had them discontinue their gum use, and then restart it after the headache had disappeared. Clearly, the activity of chewing was related to the headaches. However, the conclusion that they drew wasn't quite on the mark. Now, there were some previous studies that linked gum chewing to headaches, but offered different kinds of explanations. One suggested that gum chewing places stress on the temporomandibular joint, or the TMJs. Another blamed aspartame. Now, TMJ dysfunction has been shown to cause headaches, while the evidence is mixed on aspartame. Dr. Nathan Wattenberg, chairman of the Child Development Institute and the Child Neurology Unit at Mayo Medical Center, and also a member of this research team, he favors a TMJ explanation. Says gum retains its flavor only for a short period, which suggests that not much of the aspartame is still there. Aspartame causes headaches. He also says that a greater number of headaches will be caused by diet soft drinks because they contain it also. However, people chew gum well after the taste is gone, places a significant burden on the TMJ, and that's already the most used joint in the body. He says every doctor knows that overuse of the TMJ will cause headaches, and he believes that's what's happening in children and teenagers who chew gum excessively. The obvious next link is to look at the known fact that 90% of the pain in the body is muscular in origin, and take a look at which muscles are creating the pain, and those happen to be the ones around the temples. Obviously, those are the jaw positioning anterior temporalis, and that repeated trauma might be more of an issue for the muscles than it is for the joints. But at least they aren't saying it's self-limiting and stress-related, and if we wait long enough, they'll go away. Ask a person with migraines if they're interested in seeing if they can outlive the migraine, or if they'd rather find a solution now. What questions are you asking in your practice? If your practice is like 99% of them, your patients are dealing with bite problems. Studies show that 80% of patients have a compromised bite or airway issues, and so that would include most of your patients. Share some of your novel approaches to dealing with that in your practice down below. And don't forget to like and subscribe to LVI TV. Thanks for listening. I'm Mark Duncan.